Hello everyone, today we are going to cover suffixes in medical terminology. Our learning objectives are to identify and define useful diagnostic and procedural suffixes. We'll analyze, spell, and pronounce medical terms that contain diagnostic and procedural suffixes, and then we'll apply medical terms in real-life situations. What are suffixes? Suffixes are divided into two groups. You have diagnostic suffixes, which describe disease conditions or their symptoms, and we've got procedural suffixes, which describe procedures which are used in patient care. Let's begin with learning some diagnostic suffixes. A very commonly used diagnostic suffix is algia. Algia means pain. For example, cephalgia would be the medical term for a headache. Emia is blood condition, and ia is simply condition. Itis is very commonly used. Itis means inflammation, and it can be inflammation of many different organs. For example, hepatitis, inflammation of the liver. Carditis, inflammation of the heart. Megaly, also very commonly used. For example, hepatomegaly, inflammation of the liver. Cardiomegaly, inflammation of the heart. Oma. Oma means a tumor or a mass. Oma means a tumor or a mass. Osis. Osis means condition or abnormal condition. And pathy means a disease condition. Rhea means a flow or discharge. Rage means excessive. And ragia is a discharge of blood. Sclerosis means hardening, and urea means a condition of urine. Diagnostic suffixes, as far as adjective suffixes are concerned, each of these means pertaining to. So you can have AL or EAL, AR, ARY, or IC. All of these mean pertaining to. Let's move on to some procedural suffixes. Centesis. Centesis means the surgical puncture or asurgical puncture to remove fluid. Ectomy means removal, resection, excision, ectomy. Gram is to record. Graphy is the process of recording. Lysis. Lysis means to separate, break down, destruct. Plasty is a surgical repair or surgical correction. Scopy or scopy is a process of visual examination, and stomy is an opening. Therapy means a treatment, and tomy is an incision or to cut into. Before we go on to the medical scramble, what I'd like you to do is to make sure that you take each one of those suffixes, put them onto a flashcard, the suffix on one side, the meaning of the other, and then practice. Okay, those are very commonly used suffixes in medical terminology. Let's take a look at these medical scrambles and see if we can figure them out. Okay. See if you remember, what is the suffix meaning enlargement? The suffix meaning enlargement. So if I think about an enlarged heart, and I want to use the medical term for an enlarged heart, I would say cardio, and the answer is megaly. Megaly. M-E-G-A-L-Y. Megaly. Okay, cardiomegaly, hepatomegaly. Number 2, suffix meaning separation or to break down. Suffix meaning separation or to break down. Did you guess lysis? L-Y-S-I-S. Lysis means to separate or break down. Holding back blood from an area of the body. This one's a little bit tough. Holding back blood from an area of the body. Give you a moment to look at that. This one is ischemia. I-S-C-H-E-M-I-A. Ischemia. Holding back blood from an area of the body. We say the part has become ischemic, for example. There's no blood to it. So we got to put a couple of things together. Ear pain. Okay, let's see if you remember what the root word for ear is, and then take the word for pain that we learned. The answer is atalgia or atalgia. O-T-A-L-G-I-A. Ot means ear. Benign tumor of muscle. Benign tumor of muscle. Well, we just learned tumor is oma. Muscle is my or myo. So a benign tumor of the muscle is a myoma. M-Y-O-M-A, myoma. Notice the term benign, benign meaning non-cancerous as opposed to a sarcoma, which would be cancerous. So omas, benign, sarcomas are malignant. Sudden, sharp, or severe. Sharp, sudden, or severe. We say that the pain is acute. A-C-U-T-E. Acute means right now, suddenly, as opposed to over a prolonged period of time, which would be chronic. Let's look at the bonus term. Tumor of bone marrow. Hint, it affects multiple areas of bone marrow tissue. Did you guess myeloma? M-Y-E-L-O-M-A. Myeloma. Before I end the lecture, I would like you to look at page 115 in your book. 115 in your book. This is the pronunciation of terms for suffixes. And I want to go through the pronunciation of each of these terms so that you can hear them. And then, of course, I'm going to have you write out the meanings of those in the assignments. So listen to the pronunciation and follow along. Acute. Adenocarcinoma. Adenoma. Amniocentesis. Anastomosis. Angiography. Angioplasty. arteriosclerosis, arthralgia, arthropathy, atherosclerosis, axillary, bronchitis, bronchoscopy, carcinoma, cardiomegaly, cardiomyopathy, chemotherapy, cholecystectomy, chronic, colitis, colostomy, colocolostomy, craniotomy, cystitis, dialysis, electroencephalography, encephalopathy, erythrocytosis, esophageal, esophagitis, hematuria, hemorrhage, hysterectomy, infarction, inguinal, ischemic, laparoscopy, laparotomy, laryngitis, laryngoscopy, leukemia, leukocytosis, mammogram, mammography, mammoplasty, mastectomy, meningitis, menorrhagia, menorrhea, myalgia, myelogram, myeloma, myocardial, myoma, myosarcoma, necrosis, nephrosis, neuralgia, oophorectomy, atalgia, pelvic, peritoneal, phlebitis, phlebotomy, pneumonia, pulmonary, radiotherapy, renal, rhinoplasty, rhinorrhea, salpingectomy, septicemia, thoracocentesis, tonsillectomy, tracheostomy, urea, and vascular. So these are all terms that have the suffixes contained within them that are in this chapter. Of course, if you have any questions as you're doing the assignments, please make sure to email me so that I can help you.